Joining me today is Shari Parker, Rehabilitation Physician and Chair of Rehabilitation Medicine at St Vincent's Private Hospital. She'll be speaking at IR's Reducing Hospital Readmissions and Discharge Planning Conference, which takes place on the 25th to 26th of July 2011 in Melbourne. Hi Shari, thanks for joining me today.
Thank you.
First of all, how has St Vincent's developed an orthopaedic rehabilitation in the home programme?
Well, the key drivers for developing this program were back in 2006, the hospital realised that the length of stay for post-orthopaedic patients was really starting to increase, and the rate of discharge to private inpatient rehab hospitals was approaching 80%, which is much higher than anywhere else in Australia, let alone around the world. So hospital management saw this as a bit of a problem and started establishing some meetings between themselves, the Rehabilitation Medicine Department, the Orthopaedics Department and the discharge planners, and the hospital decided to adopt this innovative approach to rehabilitation, providing a rehab in the home program. So lots of meetings and staff recruitment and acquisition of the equipment, and 10 months later the program was born.
And can you explain the process for admitting and managing a patient through the program itself?
Sure. Well, after a patient after it's decided that a patient's going to have a hip or a knee replacement operation by their orthopaedic surgeon, they're then booked in for surgery at the hospital. Prior to their surgery, they come in for a pre-admission education session, and during that time, their post-discharge options are discussed, and those options are generally inpatient rehab or our new rehab in the home program. So it's flagged to the patients then. Then after their operation, it's discussed further with them, and if they agree to do the rehab in the home program, they undergo a number of assessments in the hospital, both by myself, the rehab physician, the occupational therapist, the physiotherapist and the nurse, to ensure that they're suitable to do our program. Our program then goes for 2 weeks, and it's an interdisciplinary, multidisciplinary rehab program consisting of 10 visits with the rehab doctor on call during that time, and case conferences which go on during that 2-week period. And at the end of that time, if there are any ongoing issues, we can then arrange further care as needed.
What have been some of the key outcomes of the program?
Firstly, clinically, we've found that there's been a really good clinical outcome in terms of joint range of motion and patients' improvement in their walking abilities. We've found a very low rate of complications and a very low rate of readmissions to hospitals. And on top of that, there have also been very substantial financial savings to the hospital. Over the first 2 years of operation, we've estimated that we have saved St Vincent's Private about $1.5 million.
What future direction are you taking for this innovative model of care, and how do you think other hospitals can adopt a similar model?
I think that our program has established itself as part of the culture at St Vincent's Private, so it will certainly continue. We're currently undergoing a research project comparing our program with standard inpatient rehab to basically demonstrate that our outcomes are very similar, with no high rates of complications and a very high patient satisfaction rate. So that's the direction that we're going. In terms of how other hospitals could adopt a similar program, I guess it's the first step on the journey is to look outside the box, to consider that there are alternative models for care. And once that decision is made, then we've demonstrated that establishing this program is really quite simple and it's an effective program.
Shari, you're speaking at IR's Reducing Hospital Readmissions and Discharge Planning Conference. It takes place on the 25th to 26th of July 2011 in Melbourne. What would you like delegates to gain from attending your presentation and the event as a whole?
I think really just rather than the specifics of the program, the concept of thinking outside that square to address problems that have been identified, and using new and novel approaches to hospital issues that are beneficial both for the patient as well as for the hospital itself.
Shari Parker, many thanks for joining me today. We look forward to your presentation in July.
Thanks so much.